Good morning again. We're going to go right to kind of a popcorn panel discussion with our audience about the community health assessment plan involvement, what organizations in the room are already doing. I want to have a shameless plug real quick. There's a group with several members in here. The American Institute for Police Reform is what the group is called. And if you could just stand up and raise your hand if you're in that group. It's Melissa, myself, the sheriff, Alan, and Jim Page. And we've talked a lot about mental health, but also about how do we communicate things in the city? And how do people know what's available and how are they able to get in contact? Especially people who have a challenge with getting the correct information. So, let's kick this off. My first question is for Melissa. and that is, what is INOVA's commitment to mental health in the city of Alexandria? And what are some new initiatives that you guys are working on that you're seeing success with?
Good morning, thank you for having me. Just to give you a little background on INOVA, we are a nonprofit health system. We are the largest employer outside the federal government with 25,000 employees. So we are more than just hospitals. We are outpatient services, doctors' offices, and so on. Similar to the health department's community needs assessment, we do a community health needs assessment. As a nonprofit system, we were required to do this, and we teamed up with the health department to do this to stop survey fatigue for our community, and we found very similar issues. So part of our CCNA, then we do an implementation plan, which we will work very closely with the partnership and the health department because we're all basically working on the same things. So we are in the same process. We have identified our top needs. They have to be approved by the board, so this is kind of a secret. But we are going to be focusing on, together, mental health and substance abuse as the same, healthcare access, because that is something that we can move the needle on, as well as economic stability. That is a huge bucket. And injury and violence prevention. That specifically speaks to some of our team members. We have seen a lot of violence in our hospital, which then goes back to mental health and all those sort of things. So that is something that we will be focusing on the community, with the community on, and very much partnering with our resources, both financially and internally, what we can do. INOVA knows that physical health is only about 10% of a person's whole health. And we actually call it behavioral health, so plug for the behavioral. But we know that it's only 10%, and all of those other social drivers of health are the other things that contribute to health. And we are very careful about saying social drivers and not determinants, because we feel like they are not determined. And we are working towards that. So they are social drivers of health. So it is everything from, can you pay your bills? Do you have food? Do you have housing? All of those sort of things. So something that INOVA does is we screen every patient for social drivers of health, and as well as depression. And we try to link them with resources to help that. In our INOVA Cares clinics, which are our clinics for those who are uninsured or underinsured, we have embedded mental health in every single one of those clinics, because we know that mental health is just as important, behavioral health, as physical health. So those are some of the initiatives that we have worked on. We also, at our Fairfax campus in the emergency department, have opened an empath unit, which is specifically for behavioral health. So we know that folks that are having issues that bring them to the emergency room with mental health issues, they don't need to be in a bed. They don't need to be around the chaos of an emergency department. They need to come cooling in a chair environment, one-on-one support with mental health professionals. And that is something that we're looking at to expand across the system. Because if you've ever been in an emergency department, you know that it is crazy. Lots and lots going on. So I just want to say that ANOVA is invested in the community, not because we have to, because we want to. It's the right thing to do. And we just continue to work with our partners, everyone in this room, specifically the health department, and Alan and his team. So thank you so much for having me.
I hope that answers the question. It was
Thank you, Melissa. That was perfect. I think this was great because we have so many new partners that are in the room who don't know this relationship has been going on for years, and it crisscrosses multiple other organizations. And the whole point of this is that we don't duplicate efforts, so that we're not wasting time, resources, funding, when we're all trying to do the exact same thing.
And I think that that is something that we've worked very hard on over the past several years, and we've gotten pretty good at. I mean, we still go to all the same meetings, but we've gotten good. We've gotten good about working together.
Christian,
And
what was the team that you're sitting next to?
that's what I was actually going down there with Dr. Mance. Dr. Mance from Howard University, welcome, good morning, always great to have you over. And could you tell us a little bit about your partnership with the City of Alexandria, how you've worked with us, and what's next? I think maybe give an update for the new people in the room of where you guys have been, and then what's going to happen moving forward.
Thank you. Good morning, everyone.
Good morning.
My name is Jashawn Mance. I'm Associate Professor of Psychology at Howard University, the former Director of Clinical Training, but I am still very much involved with the training of graduate students. I'm delighted to be here. In the past, I have worked directly with Sheriff Casey and the Sheriff's Office doing mental health trainings, really focusing on reducing stigma, increasing the conversation around mental health within the Sheriff's Office. And also there are other first responders that we would partner with as well, and hoping to cultivate that relationship in regards to reducing any stigma around mental health awareness and engagement, and mental well-being as well. As it relates to Howard University and our training program, we're actually working towards, and we got word, we're gonna wait and see how things kind of manifest, if you will, that we did have to get space for a community mental health center. So beginning to allow our students to have a lot of programs they call in-house training, and then the students will transition and then they can do external training. Howard's clinical psychology program never had in-house training. We typically just did more external training. But we did get funding and space to be able to start our community mental health center. So that would be maybe a year to 18 months in the making. But we're excited because that's definitely opportunities to get more partnerships and to be able to service more community members. Our focus is we emphasize social justice and mental health. So really training our clinicians who will be essentially leading the charge, if you will, when it comes to mental health, to really kind of think about social justice and advocacy in their work, right? And incorporating that in your research, but also within the clinical practice, and what does that look like? So that's what the partnership has looked like in the past, and kind of moving forward, I'm hoping that we can have more of our trainees within the community here in Alexandria.
Can you keep it down there with your wall? I think between the both of you, to talk about the importance of cultural competency when we're talking about mental health in our communities and getting services. Many of you guys know, because we've met each other, we've worked together, I manage a bipolar 1 disorder, and I have been hospitalized in INOVA. I've gone through CSB when I had breaks in insurance because of employment, and those have not always been great experiences. The way that clinicians talk to you is very demeaning. The way that you're treated is really, I'm an educated person, obviously I'm a professional, and I was sick. And so that is what actually kind of got my advocacy jump-started. So I think it's important when we're talking about training and we're talking about adding all these resources, how are we protecting those who are most vulnerable and who are most likely to be labeled as violent, aggressive, or handcuffed to a bed instead of being treated with the illness that they have?
in communities of color, there is a clinician bias, less innocent, more menacing. And so one of the things that we've been able to do, and this will help accelerate my presentation later, the APA Foundation hosts today the largest medical pipeline for medical students and psychiatry residents in the world. We've got trainees in 42 states and 19 countries around the world in our program, and we actually talk about clinician bias and what it looks like. And when we do didactics and when we do grand rounds, presentations, we actually have case studies. And we worked with Yale Christian all of last year on what happens in the clinician community, and the allies are more of the problem. And so one of the things that we see, Christian, when we work with young trainees, and Rudy and I will be with a group of trainees this weekend that we're bringing in from around the country. And part of it is, you're not trying to rule somebody into a mental illness, you're trying to rule people out. And so part of where clinician bias might start is a quickness to get somebody diagnosed with something, even if they don't have it. And I can tell you from personal experience, my son now is on the borderline of ADHD, but doesn't need medicine. And, just working with him, I was able to have a better conversation with his clinicians because of the role I have than if I had been a layperson, right? Because when I'm asking questions, you have a right to your own health care, physical and mental, right? So, thinking that you can't ask questions or, what are the side effects going to be? Like, go in and ask those questions just like when you bought your car, just like when you got your house or your apartment. Those same kind of questions apply to your body. And you need to be comfortable doing that and going in. And, the more digitized we become, Christian, technology's here to stay, it's not going anywhere. But at the APA and the foundation, I don't believe that AI is better than a medical doctor. Now, AI can help with the paperwork, AI maybe even help with definitions and diagnoses, but when you need treatment, you need a real person who can be looking at you on or offline trying to resonate. And so the last thing I will say is we don't jump all the way in our program, Christian, to cultural competency. We start from a position of cultural humility. And let's work the spectrum. We might get to cultural competency, but just like resilience, it's multidimensional, right? So you might be competent in some aspect of your work, but not 360 degrees competent. And it's those blind spots that cause the most problems and not helping us achieve and maintain the outcomes we want. But I do invite all of you, and you'll hear a little bit more about this in a minute. We have for our medical students a ambassadors program. It doesn't cost anything to apply. And it's quasi-open enrollment. So if you have people in your pathway who might be interested in medicine, but may not ultimately be a psychiatrist, and this is where I thought with my own board, Dr. Vance, you got to match into psychiatry, right? And I said, yeah, but if their first touch with a medical society is a psychiatric organization, won't they be better gynecologists because that's where they got their start? Won't they be better pediatricians because that's where they got their start? Won't they be better heart surgeons because their first touch with medical was with psychiatry? So we'll get you more information. Rudy and I are here all day. But if you got people you want to nominate, let's get them in the pipeline and we'll treat them kindly and we'll try to be kind.
I want to go to Alan next with the partnership, but also with all the other things that you do and how they weave it together. But I want to talk about how important it is to have lived experience when we're building out programming and when we're setting up things and who's driving that. And then what is the role? We've had lots of conversations about what does creating more space for peer navigators or peer support specialists, look like in Alexandria as we're trying to make our community healthier. And I just want to highlight Concerned Citizens Network of Alexandria, the Partnerships for Alexandria, they're all based in community. And community is people. That's why we're all gathered here. It's organizations, it's people, it's neighbors, it's businesses, it's faith leaders, all working together in community to make our city a healthier, happier place.
Well, thank you. I'm trying to figure out some of that that you brought up. But I do want to highlight a couple of things first off. You know, when we start, so this is going to be our fourth community health improvement plan. The current community health improvement plan, actually, one of the priorities the community identified out of the 3 priorities was mental health. So we've been working on mental health in the city of Alexandria for the last 5 years. And one of the things, we've become smarter ourselves on the partnership with our steering committee, because one of the things is we have a grant program, small grant program, but we have a grant program. And when we provide those grants, we find out that Move to Learn has a social emotional training program that they do connecting the brain and movement. We find out the Alexandria Soccer Association has team circles where they actually bring their soccer players together before practice to talk about social emotional learning. So, and postpartum support it was not on the radar 5 years ago. Nobody mentioned it. Because through our grant programs, we provided 2 organizations grants to start developing peer support networks for women during that time period. So these are the things that even grant programs help spark that we didn't know about. The other thing is that, you know, over the last several years, we have created greater partnerships. So 5 years ago, we didn't know each other.
Yeah.
And I had only been in St. Joseph once for a wedding. Now I'm living here with Colonel Page for you many times, which is a wonderful thing, because we often talk about, well, what's faith-based doing in this area? And by being connected to St. Joseph, I can see what they're doing. We're teaming up together, so that's really important. Lived experience. You know, the amazing thing, fortunately or unfortunately, in mental health, I think everybody in this room has some sort of lived experience, one way or another, whether it's through grief or through having a mental illness or knowing somebody in their family with it. You know, we went through and talked about, you know, who among us have had somebody in our family kill themselves. I'm sure several people in here, including myself, would say, yeah, I've lived. So we all have some sort of lived experience, which means that we need almost all 50,000 in the city? We actually need 150,000 people involved in the mental health coalition. One of the important things is that last time we didn't have we had some youth voice in developing the community health improvement plan. But we've had a lot of experiences about youth voice over the last 5 years. We now have these youth speak up forums, where the youth design and implement the forums. We're getting great information. It is our intent to create those youth speak up forums as part of each of the coalitions to make sure that we have youth voice. We partner with the Department of Community Services, who's developing their next, I think that's the 3rd or 4th, Children and Youth Community Plan. We also partner with Alexandria City Public Schools for their next strategic plan that they're working on. We have a unified planning team, and I will say a little bit of leaking out news is we've been revising our guiding principles. And one of the things we have in the guiding principles is ensuring voice, including youth voice, is embedded in all of our work. So lived experiences across the board is a major dynamic, because, you know, you don't know what's needed for somebody who's going through grieving for a lot of respects unless you've grieved. So I will just say that we want all of you involved. whether it's, we need you if you live or have influence or work, have a nonprofit that has influence in Alexandria, landmark Van Dorn area, and particularly the Mental Health Coalition, we need you all involved.